I mentioned last week that staffing is the predominant factor that's stressing hospitals out in terms of their capacity to care for patients. And so we are employing lots of different communication channels and problem-solving channels with hospitals to try to solve for the staffing issues. We've submitted federal requests, as I mentioned last time, to help support that. And we're also looking for additional funding to help support recruitment and retention of new staff for the hospitals.
I think we're pretty close to there in terms of capacity in hospitals, really around the state. The biggest limiting factor has been staff, but we're also seeing hospitals getting creative in terms of where they're placing ER patients and ICU patients. I mentioned at the beginning of this call, I toured an ICU or visited an ICU over the weekend, and there the ICU is full, and they converted a cardiac recovery unit into additional ICU space. That ICU space was full, and we have a daily call that's facilitated across the state to identify where people have needs, where hospitals have needs, and where there might be resources. And it's getting harder and harder to find solutions as hospitals say, hey, I have an ICU patient and I don't have room for him. Hey, I'm a critical access hospital in a rural community. I've got a patient that needs a higher level of care. Who can take them? And I would say right now those are tough conversations, and it's not always obvious or easy to find an answer of where to transfer a patient into a bed. And in fact, we've had one today in our call today where a patient needed to come out of a rural setting, and we were unable to find an ICU bed this morning. We hope one opens up this afternoon, but that's kind of where we are at the state level. The hospitals continue to work on this problem very closely. They've expanded space they're using for ICU, for ER, for med-surg. They continue to be creative on the staffing side. We've been helping with the requests to our federal partners and across the state. But if the question is how close are we to hospital capacity, I would say we are over hospital capacity right now.